Hi, I'm Peter James, Consultant Orthopaedic Surgeon and Group Medical Director at Circle Health Group, the largest private hospital group in the UK. Part of my role currently is to oversee the use of robotic technology and robotic surgery across our hospitals. In this video, I'm going to talk through the various surgical robotics we have at some of our hospitals, answering some of the common questions we get from patients about the technology. For example, what is robotic surgery? How does robotic surgery work and how can it help our surgeons? And most importantly, what are the benefits of robotic surgery to you as somebody considering robotic assisted treatment? So, first things first, what is robotic surgery? Put simply, robotic surgery is any operation where the surgeon is aided by a robotic tool. This is why you'll often hear it referred to as robotic assisted surgery, because we're not talking about a robot replacing a person and performing the operation. Surgical robots are just tools that we use to enhance precision during a procedure, and the more precise we're able to be, the better the potential outcomes for you. Some people hear the term robotic surgery and imagine something highly futuristic or perhaps experimental, but actually the technology has been in use for many years. It's tried and tested, and these days robotic surgery is fairly commonplace for certain procedures, including knee replacement, hip replacement, and soft tissue laparoscopic abdominal and pelvic surgery, which is essentially keyhole surgery on your abdomen, and can include anything from hernia surgery to prostate surgery to a robotic hysterectomy. At Circle Health Group, some of our consultants use robotic tools to help them perform surgery. Others don't. As is common with surgical tools, it comes down to personal preference. Robotic surgery in certain cases can offer benefits over traditional methods. But the most important factor in the success of any operation is a great surgeon surrounded by an excellent clinical team. Investing in robotics is just one of many ways we are supporting our consultants and our wider teams to offer our patients the best standards of care we possibly can. How does robotic surgery work? There are various robotic tools out there, and they all work slightly differently. In most cases, however, the basics are the same. The robotic tool will consist of three main components: a surgeon's console, a patient side cart with robotic arms, and a high-definition monitor featuring a 3D visualization system. During surgery, the surgeon sits at the console, away from the operating table, using hand and foot controls to guide the robotic arms with high levels of precision, watching everything in high definition on the monitor. The robotic arms are equipped with tiny surgical instruments that mimic the surgeon's movements in real time, but on a much smaller scale and steadier scale. Some systems even include advanced imaging and AI-assisted features to enhance accuracy. The setup is designed to maximize control, minimize invasiveness, and allow for delicate procedures that would be more difficult with the human hand alone. Some orthopaedic robots are more like handheld devices rather than robotic arm devices, but the general process is very similar. Robotic technology gives the surgeon the ability to work with much more precision before and during treatment, helping with accuracy and reduced tissue damage. So, what can robotic surgery be used for? At Circle, we use two main types of surgical robot. Firstly, orthopaedic robots, and secondly, soft tissue robots. Orthopaedics is a medicine of bones and joints, and orthopaedic robots are generally used to perform knee replacements as well as hip replacements. The imaging technology allows us as surgeons to understand your unique anatomy with incredible precision. Surgeons are able to navigate your joint with increased accuracy and precision to help discern where to make the bone cuts and where to exactly position the prosthesis, also known as an implant, to make sure your new joint works well. Soft tissue robots are typically used for laparoscopic surgery, which is minimally invasive surgery, often called keyhole surgery, performed through small incisions into your abdomen. You might have a robotic laparoscopy for a hernia, for example. Or you might have a robotic prostatectomy or hysterectomy. Again, the visualization tool enhances a surgeon's ability to see your anatomy in great detail, allowing them to navigate with precision. What are the benefits of robotic surgery? When used by a skilled surgeon, robotic technology has the potential to improve patient outcomes, which for you could mean that you might be in less pain and perhaps have a shorter recovery period. Or it might mean that the long-term effects of your surgery are better than average. Recovery is different for everyone, but studies have shown that robotic surgery can get you back on your feet faster than traditional methods. You might benefit from reduced post-operative pain, a reduced hospital stay, and there is a lower chance of complications or readmission. Studies have also shown that robotic surgery can lead to a faster return to normal activities than traditional surgery. These benefits are as a result of the increased accuracy, which reduces damage to surrounding tissues. There are also benefits specific to individual procedures. For example, an orthopaedic robot might help your surgeon to position your knee or hip prosthesis more accurately than otherwise, resulting in a replacement joint that feels more normal or natural. Another example is a robotic prostatectomy, where the increased precision offered by the robotic tool may allow your surgeon to preserve more healthy tissues and nerve endings around the prostate. This then reduces the risk of damaging sexual function, both in the short and longer term. How do I know if robotic surgery is right for me? The answer to this really will be different for everyone. It will depend on personal factors, from the type of surgery you need to your age and health, and can only be decided after an in-depth discussion with a consultant surgeon. I would advise you to focus first on finding a great surgeon who specializes in the treatment you need. Surgical robots are amazing tools, but they're only as good as a surgeon who operates them. At Circle Health Group, we work with thousands of expert surgeons all over the UK, and our website will help you find a specialist near you. They will be able to give you tailored advice and help you make the right decision for your own personal circumstances. Thank you for watching this video. I really hope you found it helpful. If you have any more questions about robotic surgery, leave your comment in the section below and we will get back to you. If you would like to arrange a consultation with me or any of the other leading specialists at Circle, you can book an appointment at circlehealthgroup.co.uk.